There's a high need for these real-world cohort database studies from the funding standpoint, from the ministries of each province, from PCODER, our National Evaluation Board, PERC, the Economic Evaluation Committee for the national negotiations as well. There's a desire when we're looking for new therapies to be funded, what the true comparisons are from a real-world standpoint. How are the drugs actually being used in Canada? How long are they lasting for? How are people doing on them as well? Because there is noted differences between the treated population and the population that is often seen in clinical trials, with clinical trials offering a fitter population most commonly. So these real-world cohorts offer a look at how these drugs are actually being used and can offer a better calculation of value, I think, when trying to get new drugs to market in Canada and in the hands of patients as well, which is the most important. In multiple myeloma, there's been a wealth of an explosion of new therapies, something which is also being seen in acute leukemias, in chronic lymphocytic leukemias, and many of the hematologic cancers. So I think in multiple myeloma, we're lucky with Dr. Venner having spearheaded this with the MCRN, that we have a database with over 6,000 patient encounters, individual points of data that can be used for this going back more than a decade. So it's something that certainly there are learnings for our colleagues and in the acute leukemia world and CLL world, that hopefully they can also utilize these real-world databases in order to get their highly effective new therapies funded as well. So this is something which is of key importance, I think, in the Canadian landscape.